Hi everyone, welcome. This presentation is There Were Many Tough Days, Early Childhood Educators, Emotional Wellbeing During COVID-19 Pandemic. And my name is Gloria Quinones and my colleagues.
Hi, I'm Emily Berger.
And I'm Melissa Barnes.
So welcome. Before we start, we're going to start with acknowledgement of country. We pay our respects to the peoples of the Kulin Nations on whose traditional states we meet today, to their ancestors and to the children who we are educating into the future. We also acknowledge other Aboriginal and Torres Strait Islander peoples who are present. Okay, so we're going to start with the research aims. Mel?
Really, I think, first of all, it might be important to kind of note how this came about. When COVID-19 first occurred, there was a lot of school closures. And what was interesting is that for most of this period, early child education stayed open. And so this kind of brought us to the idea of really thinking about what's happening and wanting to know more specifically about how this has impacted educators' emotional experiences, those who have been working in early child education during this COVID-19 pandemic. More specifically, we really wanted to look at their current state of mental and emotional well-being, but also we wanted to examine how these educators responded and provided support to children and families. The other thing we were interested in is finding out what kind of support these educators were given and what they required to be able to respond effectively to the pandemic. And finally, given what was happening, we really wanted to provide a voice for early childhood educators in Australia, particularly because the way they were positioned during this pandemic. We felt that it was really important to really capture those voices.
Thanks, Mel. So as Mel said, this really came about because we were really interested in early childhood educators and how they were, in a sense, holding communities and families together during the pandemic. And so based on what we knew from the existing literature, really international literature that we were exploring, a lot of the literature around COVID-19 was really focused on families, how families were coping and managing, but also the increased anxiety, stress, and problems concentrating that children were experiencing as well. So we thought it was really important because of the extra stresses on families due to COVID-19. We felt that it was really important to also look at early childhood educators' wellbeing and their mental health at this time, and the wider structures that sit around them, and how well the wider structures were able to support them or not during an unprecedented pandemic.
Yes, I think also important because we thought that COVID-19 was a time where we could also focus on the well-being and mental health of early childhood educators, which was also important. Mm-hmm. Because of that, we focus on this concept of emotional labor from Hosh Shield. And something really important for us was this question that they ask: what do we do when we manage our emotions in the workplace, in our everyday jobs? And these are just some quotes about how it's not only the job that we do physically, but also the mental and the emotional. There is more into it. And how in this really stressful and challenging time, which was COVID-19, how this emotional labor adds on to these different feelings and emotions that are happening in the workplace. So this concept of labor or emotional labor, how in our workplace or where we work, how these impact in our emotions, and these are sometimes not really visible. So we really wanted to find that collective voice of early childhood educators and find their mental, their health, their emotions, all these different components and dimensions. And especially in how early childhood education as a specialized profession as well, that involves children, families, and of course, all these different relationships and emotional tasks as well, different emotional activities with families and children. And also how these emotional labor, this emotional work, also can lead to overwhelming distress, stress, and how educators were remaining present in their everyday jobs.
Thanks, Gloria. So, what we planned to do was really to try to replicate some of the literature around other pandemic events, but other traumatic events or other difficult events that people might have experienced. And so we chose to do this using a mixed methodology, so involving both surveys but also follow-up interviews. And within our surveys, while we also had open-ended questions, so that we could link the survey responses, what people were saying and educators were saying about their wellbeing, and link that to some of those open-ended responses around support needs, what was happening at the time, what could change, what were the strengths, but what could change next time, or what could change into the future. And so, as I said, we used a survey of 216 early childhood educators around the issues of how they're coping, what their wellbeing is. We used a scale called the Impact of Event Scale, which looks at psychological distress in relation to a difficult event, an adverse event, and in this case, obviously, it was in relation to COVID-19. From the survey involving that scale, but also open-ended questions, we also asked participants whether they would be willing to participate in a follow-up interview so that we could learn more about their responses and anything else they wanted to share with us about the experience that they've had at this time. And so we were very lucky. We had 80 early childhood educators who expressed an interest, and from those we were able to interview 30. And that occurred this year during July and August.
Yes, and thanks, Emily. These are some of the findings that we are beginning to analyze, just these findings, and something that we found out in both the quantitative and the qualitative findings in the survey and the interviews was that there were negative effects on early childhood educators' psychological and physical health. There were also higher degrees of emotional labor during COVID-19, and basically educators dealing with their own emotions, but also those affecting children and families, and also it increased stress and external pressures as well in the early childhood educators.
Yeah, so in relation to, just following up from what Gloria was talking about, in relation to the quantitative findings from the survey, as I said, we use the impact of event scale, and using the impact of event scale in relation to COVID, what we were able to do is look at those who are in a low level of risk for distress, post-traumatic distress in relation to COVID, those at a moderate level and those at a high level, and we're able to separate out those groups. And so we found over 66% were in the low range in terms of showing signs and symptoms of post-traumatic distress. About 11%, a little over 11%, were in the moderate range. And I think most importantly and interestingly for us was that there was a clear impact for over 21%, showing a high level of distress and showing symptoms and signs that are related to and probably showing levels of post-traumatic distress for those people based on the impact of event scale.
So in relation to higher degrees of emotional labor affecting the well-being of educators, these are some comments from the educators, from Faith and Jamie, and how really exhausting it was mentally and physically, and draining, and how they were spending much more time with families as well. So this was something really emotional for them. And Mel, would you like to make a comment?
Yeah, I think, we had 30 different educators that we interviewed, and I think all of them took their jobs obviously very seriously, and they wanted to make sure that they provided a very good education as well as provide care. And I think what happened with COVID-19 is when it came, there was obviously their own personal kind of making sure that, you know, at home, all of those issues that they had to take care of and how that impacted them personally. But also it really impacted their workplace. And I think that, you know, there was extra workload based on, you know, making sure that they're communicating with parents and communicating with staff. So if they were in a leadership position, there was a lot of stress in managing and knowing that the numbers were low for many centers and or kinders and being able to manage that financially. So there was this range of different kind of, I guess, actual physical labor that they had to do that actually had an impact on their emotional labor and being able to manage all of those things, but also really wanting to make sure that they protected in many ways the children and the families in their center. So they were doing a lot of extra things, and that actually did have an impact on, you know, their exhaustion and their mental and physical well-being.
I think adding to this, some positives, and we'll talk about this, some positives as Jamie is saying, how they were able to put themselves as well, and how also they show levels of resilience as well. That was really important. But this also shows how their emotional labor and how something really small was quite big and stressful. So that was something that the educators mentioned. And this educator, Rita, making comments about the families, how, for example, how also some of the positives was that they were feeling quite appreciated by the families, how they were appreciating what they were doing, and how these as well professionally increase more their work and the different roles that they were also taking. But also something that they mentioned was how they felt that in terms of they were valued as a childcare service, however not much as an educational facility. So that was something that they mentioned, and Mel, you have to comment.
Yeah, I think historically, I think that early childhood education has always been in this very strange positioning, partly because there's a range. There's kinders, they can be in private schools, they can be in local councils, centers that have very big management boards and those that are very independent and small. But I think one of the things that was very consistent is that there's always, and historically, there's been this kind of this tension between, you know, feeling that they're just childcare and not necessarily a viable education service. And I think this came out a lot, given that there were a lot of closures at the very beginning with schools. And this wasn't actually, there was no discussion about how that would affect early childhood centers and kinders. And, you know, in Victoria, we obviously later did close early childhood centers and kinders. But before that, there was this feeling of like, well, are we not important? And this idea that they are very essential. But I think in that, there was this kind of conflict of going, we're important to help the parents and families be able to go to work, but are we valued as educators? And I think there was that tension. But I think as Gloria has said, there's been a lot of positives, and that they actually did a lot in reaching out to families. And I think families realized what a support network they are. And actually a lot of these centers and kinders were looking after parents and families just as much as they were looking after children, and really making sure that, but obviously this came at a cost for their own emotional well-being.
Yes, and of course, the burnout and the stress was also part of this emotional labor. And Hannah, in this read, she mentioned a positive case in the center, and how this was of course very stressful, and how at the beginning of COVID-19 there was not enough information and assistance. And of course, the stress was not only on her, but the stress on families with, for example, pregnant mothers or families that have low immune system. They were really worrying about that COVID-19 case. So I think this was at the end a learning experience, and having support from someone is really important. And these are also part of the findings that we have here, that actually this educator went to a counselor rather than a psychologist. she talks about that, and that's really important, that they also need assistance and support, and that it's important to check that you're not taking too much on you. And of course, with COVID-19 being a stressful time, really important to be aware of this. And I think this was something that now early childhood educators were more conscious about as well.
The only thing I would add,
Yes, ma'am.
is really that given that this was a new kind of phenomenon for everyone, and knowing how to address a positive case, I think that there was a lot of anxiety of making sure, like, how do I communicate this? What is the best practice? And when you are an educator who knows your job really well, you take a lot of pride in doing that well. But when there was this new kind of way of trying to communicate with families, to understand actually the situation at hand and what they needed to do, there was a lot of anxiety and stress in that. But as Gloria has mentioned, I think a lot of them did come to the table and they worked it out and they managed it. But that again came with a cost. And I think there was also this overlay of anxiety in the case that there might be a case in the future. And I think that took a lot out of many of these educators.
So thank you both. I'm just going to speak just briefly in a couple of slides about the implications and where we can go from here. And we'd love to hear about your perspectives and your thoughts after you've viewed this video. But when we looked at the implications, and Gloria and Mel have touched on some of the implications as well, but it's really about looking at both sides of the coin. So as we found, there was some over 20% were experiencing this high level of post-traumatic distress in relation to COVID-19. Obviously, that's having impacts for them in terms of their personal well-being, how well they can take care of themselves, their own families, but also how well they can take care of the children and the families that are relying on them to support them. So we think that that's a really important population, that more resources and more support needs to be built around those educators, because unfortunately, what I guess, when we're looking at that, what we found is that, people were saying, educators were saying that they were potentially thinking about leaving the profession. And so we're potentially losing a lot of those great lessons and learnings and all the resilience and agency that a lot of educators showed at this time. We're potentially losing those educators and professionals from the profession. So, and the other side of the coin, as has been raised, is the resilience and agency that was shown by educators. And I think part of it, when we look at the wider trauma literature and adversity literature, is it's looking at an area called post-traumatic growth, that we actually can grow and learn from adversity if we know how to harness it and if we know how to reflect on it. And of course, if we know how to maintain people in the profession so that we can actually build and grow on the lessons that have been learned, and so that they can inform future policies as well. Just one last point on this slide that I wanted to raise was in relation to feeling valued, and that is part of a post-traumatic growth and resilience following an adversity or a traumatic experience, is to feel valued, to feel that you've made a difference. And that was clearly identified by the educators as well, that they really appreciated feeling valued. It helps to prevent burnout in educators as well, because educators have a sense of what they're doing that's right. And if we know our role and what we can do that's the right thing to do by getting that feedback, then it means that we're going to build resilience and we're more likely to act that way in the future. Unfortunately, the other side of the coin was that there was limited sense of feeling valued by the government or being acknowledged in educational policy around COVID-19, and that focus of educational policy perceived to be more focused on primary and secondary schools rather than the early childhood sector. So just the next slide. So just in relation to just some final implications, I guess, implications, we talk about implications in terms of the personal well-being and self-care of educators, particularly those over 20% who experienced you know, some severe psychological distress in relation to COVID-19. So professional learning, I think, is needed for supporting their well-being, but it's also supporting strategies around self-care. How do they enact self-care? How do they use self-care? What's their motivation for self-care? When we look at the wider literature around self-care, we actually find that people in a caring industry, such as early childhood educators, tend not to prioritise their own self-care. So it's also about motivation as much as it is about having ideas around self-care. So wider systemic change as well. So how do early childhood centres, how do they support each other? How are they doing that and how are they supporting each other? But then wider than that, looking at the policies, and educators would have a lot to share from this time and for future adversities around what policy should look like, so that, you know, they're not, you know, guessing in terms of what should be done next time there's a pandemic or next time there's an adversity, that we have some really clear-cut policy and we define their roles as well. So we're preventing role confusion, we're preventing burnout, and we're also making sure that educators feel that they are valued enough to have a policy in place that's going to help to support them in future instances of pandemics or other adversities. So that's really all from us. Thank you so much for your time. Thank you so much for listening. Please tweet us or get in contact with us if you want to learn more or you want to have further discussions about this area that we're all really passionate about. So thanks very much, everyone.
Thank you.
Thank you.